New Zealand's mobile operating theatre has today been awarded a further 3-year $12 million contract. The bus has already hosted operations on nearly 20,000 New Zealand patients in their rural communities. Health reporter Laurie Mason travelled to Clyde in central Otago to see the bus at work.
It's cruised our rural highways and byways for the past 13 years, from Cape Reinga to the Bluff, pulling into 23 rural towns on a 5-week rotation.
What we're often told that this is, our bus is coming to town, so they really take ownership.
Today it's Dunstan Hospital's turn in central Otago's Clyde. The bus is hooked up for power and water, then it's on to the first of 5 hernia repairs.
Looking forward to getting it sorted.
All patients are locals like Bob Kinnaird and Betty Clearwater, now saved from having to trek to Invercargill or Dunedin for their surgery.
No travelling, wonderful.
The surgery do is low risk, it's safe. The fact that you have to walk from the waiting room through the car park is not a big deal really, because once you're inside it just feels like an operating theatre.
300 different types of surgery are offered on board, from orthopaedic to gynaecological, even dental.
I would say they've got every mod con in there you want.
Dunedin General Surgeon Graham Miller's in charge today.
It means that we can treat our patients closer to home, and they can get the support from their families directly.
Apart from making a significant dent in New Zealand's surgical waiting list, this big blue bus has provided a lifeline for rural hospitals like Dunstan here, which has seen their surgical theatres progressively shut down over time. It's also provided hands-on training for rural hospital doctors and nurses. The Health Ministry's now extended the bus's contract for a further 3 years. It pays $4 million for 1,500 operations per annum. That cost hasn't risen for years.
So better deals with purchasing, we're buying smarter, and the way that we run has become far more efficient than we ever have done.
Providing value for taxpayers, keeping rural communities connected.
I think it's a wonderful thing.
Laurie Mason, One News.